Today we are going to look at parasites and their role throughout human history. Our ancient ancestors were subject to every manner of disease and accident that one can imagine. Although many of them did not realize it at the time, they were also infested with parasites. Treatments for many of these are now available, but the same parasites that plagued our ancestors are still abundant in the natural world today. Parasites tend to evoke a primal response in humans, one of universal disgust, along with a desire to avoid them at all costs. To fully understand how they have impacted humans, we need to first understand more about parasites in general. A parasite is an organism that lives within or on a host. It uses resources from the host to sustain itself, and also uses those same resources to support its reproduction efforts. Although parasites have undoubtedly caused much disfigurement and death, it is also possible that they are, surprisingly, not without their benefits. To fully understand how they have impacted humans, we need to first understand more about parasites in general. They vary widely in size. 70% of known parasites are not visible to the naked eye. Some worm parasites, however, can reach over 30 meters or 98 feet in length. All parasites fall into one of two primary categories. Endoparasites live within or on the host. They usually rely on a carrier organism to move from one host to another. Epiparasites feed on other parasites. For instance, although a flea might live on a dog, another parasite might live in the flea. Thankfully, this category is not often relevant where humans are concerned. Once an organism is classified as a type of parasite, it can be further divided into additional categories. We shall discuss the most common three. Protozoa are single-celled organisms that can only multiply and divide within a host. The organism that causes malaria is one example. Helminths are worm parasites. Most of the human-related parasites we discuss will fall into this category. Ectoparasites live on rather than inside their hosts. Lice and fleas qualify as ectoparasites. We certainly don't have time to discuss every parasite, but we will discuss a few specific types. First, let's look at some common endoparasites that infect humans. Giardia, also known as beaver fever, affects the lumen of the small intestine. It can cause diarrhea, dehydration, and other unpleasant abdominal pains. Ingesting food or water infected with cysts is the primary means of transmission. This parasite is very common, even in modern Western societies. Usually it can be eliminated with proper treatment and is not fatal. Leishmaniasis is a parasite transmitted by some types of sandflies. It can be fatal under certain conditions. It can affect the skin, as well as mucous membranes of the mouth, nose, and throat. This is passed on through an amoeba known as Naegleria fowleri. It affects the brain and nervous system and is usually fatal in between 1 and 18 days. It is transmitted by inhaling contaminated soil and contaminated water. If there was a contender for the highest body count, malaria would certainly be the victor. It is a parasite transmitted by mosquitoes, most commonly in tropical regions. Malaria causes fever and hallucination, and a variety of other side effects. It is not always fatal, although it can be in many cases. Toxoplasmosis is a parasitic pneumonia caused by the parasite Toxoplasma gondii. It occurs all over the world and affects the liver, heart, and brain. It can be acquired via undercooked meat or milk, or through contact with food or soil that has been in contact with cat feces. As if being a woman did not already come with a long list of complications, you can add trichomoniasis to the list. It is a sexually transmitted infection caused by the parasite Trichomonas vaginalis, Men can carry this parasite as well, but usually exhibit no symptoms. Trypanosomiasis, or sleeping sickness, is passed to humans by the tsetse fly. This most commonly affects the central nervous system and changes sleeping patterns. It is fatal if left untreated. All of the parasites mentioned so far comprise just a small number of endoparasites that plague humanity. Most ectoparasites, by contrast, live on their hosts and survive by feeding off the blood or tissues of humans they encounter. Bedbugs, lice, and scabies are some of the more common ectoparasites that humans will encounter. They spread via skin-to-skin contact and via sharing clothing or bedding that has been in contact with the parasites. The vast majority of humans who have hosted a parasite did so by providing a home for worms. Given this fact, it might be useful to examine the most common worms that prefer to live in people. It might also be comforting to know that modern medicine can treat most of them. It is possible to be infected with a parasitic worm and have no symptoms at all. Some general symptoms that may be encountered are nausea, lack of appetite, diarrhea, abdominal pain, weight loss, and general weakness. There are additional symptoms specific to each type of worm. Tapeworms are typically ingested by drinking contaminated water or eating contaminated meat. A tapeworm will embed its head into the intestinal wall and stay there. One specimen was measured at nearly 80 feet in length. It is also possible for a tapeworm to live in a person for up to 30 years. When they cause symptoms, tapeworms can result in lumps or bumps, allergic reaction, fever, and neurological symptoms, such as seizures. Flukes are more rare in humans. Usually contaminated water is where they can be found. They like to live in the blood, intestines, or other tissues. They reach a few inches in size at the most. It can take weeks or months to notice a fluke infection. They may cause fever and fatigue. Hookworms are transmitted via feces and contaminated soil. The most common method for catching them is to walk barefoot on soil that contains hookworm larvae. They live in the small intestine and are usually less than an inch long. Hookworms can cause a rash, anemia, and fatigue. Pinworms are most commonly found in children. They are mostly harmless and live in the colon and rectum. The females tend to lay eggs near the anus, usually at night when the host is sleeping. When pinworms are not harmless, they can cause appendicitis or symptoms of appendicitis. Eating undercooked meat could allow one to catch trichinosis. The larvae mature in the intestines, but then move on to other tissues. They are not what one would consider a pleasant guest. The symptoms related to trichinosis are fever, swelling of the face, muscle pain and tenderness, headache, light sensitivity, and conjunctivitis. Throughout most of human history, it was difficult, if not impossible, to diagnose parasitic worms. Modern medicine has some techniques to do so, which have their own forms of unpleasantness. A fecal test can be used to find worms. This checks feces of the patient for live parasites, larvae, or eggs. If the fecal test doesn't show evidence of parasites as a cause for diarrhea, then it might be necessary to perform a colonoscopy. Blood tests, as well as MRI and CT scans, are also used to find parasites. One special diagnostic method used to find pinworms is called the tape test. Clear tape is placed around the anus. The tape can then be examined under a microscope to see if there is evidence of pinworm eggs. Sometimes, however, the eggs can be seen with the naked eye. Treatment typically involves taking a medication designed to eradicate the worm. In some severe cases, surgery may be required, however. Understanding medical conditions in the ancient world is always difficult. The field of paleoparasitology has been able to determine with surprising precision the types of parasites that infected our ancestors. Paleoparasitology primarily examines human feces, latrines, cesspools, and soil from burials. The experts in this field were able to determine that in ancient China, tapeworm and roundworm were very common. Unfortunately, so were flukes, hookworms, and head lice. Some unlucky victims in ancient China led an uncomfortable existence. Ancient Rome, it seems, was also infested with parasites. What is truly surprising is that Imperial Romans had higher numbers of whipworm and roundworm than their Bronze Age and Iron Age ancestors. Rome had some semi-modern sanitation practices which would suggest it should have fewer worm problems. Although nobody knows for certain, a popular theory is that baths were the source of worm infestations. The water was kept warm and changed very rarely. Also, uncooked fermented fish sauce was a popular item in the empire. This is considered an explanation for why fish tapeworm was also common. In some cases, studying parasites illustrates changes in a population's diet. Researchers studying a medieval latrine in Germany first found a high number of tapeworms that come from freshwater fish. Further analysis showed that in the 1300s, the tapeworms switched to a type normally associated with beef. The people in this area switched from fishing to farming for reasons not entirely understood. Ancient droppings were found on the Greek island of Kea. These droppings were found to contain eggs for whipworm and roundworm. Hippocrates first described these over 2,500 years ago. But researchers found the presence of the eggs extended to the Bronze Age, which showed the problem existed long before Hippocrates. Sometimes, studying parasite DNA can reveal where a population has traveled. Researchers found that northern European whipworms from 1000 AD to 1700 AD were very closely related to ones found in present-day Uganda. Clearly, the two populations were in close proximity at some point. Although most people prefer to avoid parasites, for some, having them might be beneficial. There is a claim that modern hygiene has caused some people to have greater instances of allergies and autoimmune disorders. This is known as the Hygiene Hypothesis. There are some studies which support this hypothesis. One study showed that people with parasites, or people that recently had parasites, had fewer autoimmune conditions. Clinical trials with ulcerative colitis and Crohn's disease patients reduced disease activity after exposure to intestinal parasites. The mechanism isn't known for certain, but advocates claim that the worms reset the host's immune system, which in turn reduces autoimmune disease symptoms. Although humans cannot see most parasites, it has been theorized that there is a mechanism called the behavioral immune system, which helps with parasite avoidance. This mechanism is simply reacting in a hypersensitive manner to the perception of parasites in the immediate environment. To put it in a modern context, imagine you see somebody with head lice next to you. You will probably feel a desire to escape the area, and may even feel as if your head is itching due to imagining the lice infestation. This would be a manifestation of the behavioral immune system. Overall, humans are potential hosts to nearly 300 species of worms and over 70 species of protozoa. Some of these come from our primate ancestors. However, as the study of parasite DNA has shown, the majority of our parasites arrived in the past 11,000 years. Living in larger groups and the discovery of agriculture and animal husbandry was almost certainly the catalyst. Clearly, being infected with parasites is a problem. There is a risk of very unpleasant symptoms under the best of circumstances. At worst, a slow and painful death is the result. However, due to removing parasites as a concern for most humans within the past few hundred years, it seems another set of problems might now exist. Our ancestors suffered because of parasites. We suffer because our immune systems might not have been trained properly without exposure to those same parasites. Science concerning the hygiene hypothesis is not settled, so it would definitely not be a good idea to purposely infect yourself with worms. What the existing evidence does demonstrate is that humans and parasites evolved with each other. The people of the past were almost never without parasites of some sort. Those of us in modern times who do not have any parasites are among the privileged few when placed into historical context. The evidence also clearly shows that parasites evolve as humans change their environment. Thus, much like with antibiotic resistance, it is quite possible that current treatments for worms and other parasites may start to lose effectiveness. The time during which people can live parasite-free may be quite short if treatment options are not able to match the pace of natural selection. Do you think that modern humans can win the fight against parasites? Or is it a battle we are destined to lose? Please let us know in the comments. Thank you for watching Bad Things in History.